دكتور عبدالرحمن عبدالمقصود، دكتور أحمد رامي، دكتورة ملك الشرقاوي، دكتورة نادين خالد. اتفضلوا.
بصوا هنسيب لكم التشيرز دول تبقى انتوا كده جنب المايك وننقل اللي احنا
Good morning. So the very first session is, sorry, just one. Okay, the very first session is the use of virtual reality in pediatric mental health, and it's my pleasure to introduce Abdelrahman Abdelmaksoud, Ahmed Ramy, Malak al-Sharkawy, and Nadeen Khaled.
Let's start.
Good morning, everyone. Thank you all for being here today. I'm excited to talk to you about a cutting-edge development in pediatric mental health, the use of virtual reality. As you know, mental health challenges among children and adolescents are a growing concern, and the use of traditional therapeutic approaches tend to face limitations in engaging young patients. Virtual reality offers a revolutionary way to address these challenges by creating a controlled and safe environment, allowing these children to express their emotions, confront their fears, and learn coping skills. My name is Abdelrahman. My colleagues' names are Ahmed, Nadeen, and Malak, and we are a group of fourth-year medical students at Cairo University, and we are proud and honored to be with you here today to explore together some of the clinical applications of virtual reality, some of its adverse effects, and a number of successful clinical trials that highlight its potential to transform the mental health landscape for our youngest patients. Please note that every slide will have a QR code that directs you to the citations of the discussed topic. Let's delve into this innovative approach, starting with my colleague Ahmed.
Thank you, Abdelrahman, for this enlightening introduction. I will continue from here. We will start our journey speaking about exposure therapy. What is virtual reality exposure therapy? Virtual reality exposure therapy immerses the participant in a computer-generated environment, which has shown success in tackling the following: phobias, such as heights and flying, panic disorders, PTSD, and anxiety-related disorders. How can this be achieved? This can be achieved by mimicking stressors, triggers, and fears that the patient may have. For example, if a child has a fear of flying, we can expose him to takeoff and landing without actually stepping on a real plane. Additionally, a study which included cognitive behavioral therapy and virtual reality exposure therapy, targeting children with autism spectrum disorders and specific phobias, has shown very successful results. It has led to 8 of the 9 participants to improve their clinical symptoms, with effects lasting to 12 months and success rate of approximately 90%. This evidence supports that virtual reality exposure therapy has illustrated its potential, yet further research is necessary. Moreover, a systematic review of 4 trials done on 100 children aged between 8 and 16 years old has shown that there was clinical enhancement and improvement in their anxiety symptoms. But more controlled trials are needed to show effectiveness in this age group. In fact, virtual reality exposure therapy has proved to be efficient, cost-effective, but, however, lacking of literature focusing specifically on its use in this young age. Now, my colleague Nadeen will take off from here.
Thank you, Ahmed. I'm going to be continuing from here. Today I'm going to, Okay, I'm going to be discussing the use of virtual reality as a distraction and relaxation method. Okay, so the first application I'm going to be discussing is the Happy Place application. The study aimed to evaluate the effectiveness of using the virtual reality headset distraction technique for children undergoing short painful procedures in the pediatric emergency department. For example, cannulation, venipuncture, wound closure, and foreign body removal. They compared the distraction levels of children using the virtual reality headset with the traditional distraction methods, which is basically a play specialist with a child's favorite book, tablet, or game. 20 patients were recruited for each group, and the distractions were assessed using special tests. Results showed that although the virtual reality didn't significantly increase distraction levels compared with the traditional methods, but they exhibited way fewer pain behaviors. Parents provided positive feedback, and the staff were enthusiastic about its success. The study suggests that the virtual reality headsets could be a convenient distraction tool, especially during off hours when no play specialists are available, but it should not be used to replace their expertise. Okay, the second application we're going to be discussing is the Space Pub's virtual reality application. It was designed to provide real-time reorientation and cognitive load modulation for pediatric patients. It was launched as a part of the Stanford Chariot program, and it demonstrated successive utilization across various medical contexts without any reported side effects. It has been used in wound care, the ENT clinic, perioperative care, and vascular access a total of 1,696 times. Significant improvements in affect were observed pre and post virtual reality use, suggesting its potential as a non-pharmacological approach to enhance patients' cooperation. Now, my colleague Abdelrahman will continue again.
Thank you, Nadeen. One of the most important clinical applications of virtual reality is its use in children with autism spectrum disorder. In one study, Open Simulator was used to create a social skills environment, allowing improvements in the social skills among 7 children aging 10 to 14 in a 20-hour program. In another study, virtual reality was used to create a virtual shop called Bob's Fish Place, aiming at enhancing the conversation skills among the participants, and it proved both feasible and engaging. In a third study, virtual reality was used to aid children in transitioning from kindergarten to primary school, and it showed great improvements in their emotion recognition, affective expression, and social reciprocity. These studies, among many others, highlight VR's importance and potential in bypassing the limitations of traditional therapeutic approaches and improving these children's lives. Now to my colleague, Malak.
Not to disappoint you all, but like everything else in life, virtual reality is bittersweet. And here's the dark side of it. There are medical researchers and physicians have reported some adverse effects that affected the children. Just can't find my slide. Okay. Okay. Some physicians, sorry for the interruption, physicians and medical researchers have reported that their patients said they suffer from eye fatigability, nausea, vomiting, and position instability, cardiovascular problems, and these are the physical effects known under the name of cyber sickness syndrome, which is a new syndrome caused by the new technologies every day. But although these are very major concerns, but the most stunning and drastic effects of virtual reality use is their psychiatric effect on the pediatric patients. First of all, it can cause, which was reported by some doctors, addiction and social isolation, and sleep disorders, and it has also been reported to worsen the post-traumatic stress disorder, and some reduction in the cognitive performance of children. Moreover, and most importantly, that some doctors reported that the use of virtual reality headset can worsen the anxiety symptoms, specifically for the patients with autism syndrome, due to the multiple sensory stimuli which cause irritation for autistic children. And lastly, it can also cause depersonalization and derealization. Children become unable to differentiate between real life and virtual life, which can cause irritable effects, and they become very angry. In conclusion, the introduction of virtual reality in psychiatric medicine might be a step to come, but the question will always remain: is it the physician's weapon, or is it the weapon physicians are fighting against? And the answer will always be in the hand of researchers. Thank you. We want to thank Dr. Antoine Fakhry for his supervision, Dr. Mohammed Omar, and Dr. Ayman Emil, and everyone who listened and participated in this conference. Thank you all.